Hello, everyone. Thank you for watching this short video about oral health and why it matters so much. My name is Jenny, and along with my friends Brianna, Raimi, Skylar, and Sadie, we will present to you the research we have compiled with the hope that we can inspire you to make your own oral health a priority. And not only that, but we'll also tell you where you can find affordable resources that are available for you to use. These are a couple of pictures of our dental hygiene team at Sacramento City College, which happens to be one of the affordable resources that are available to those of you in the Sacramento area. Most of you may already know the most important parts of oral hygiene care, like how we need to brush our teeth twice a day, floss once a day, and attend regular dental cleanings, usually every 6 months. But we're here to tell you a little bit more about how your oral health affects the rest of your body, some of the good habits that contribute to your oral health, as well as some of the bad habits. And after we go over all of that information, we'll leave you with a list of the resources that we were able to find for you to use. So Brianna is going to take it from here to tell you about something called the oral systemic link. All right, thank you, Jenny. As stated, I am going to be talking about the oral systemic health link, which is basically the relationship of the health of your mouth with the rest of your body. I think it's exceptionally common to not always be mindful that your mouth is connected to the rest of your body. So if one of these areas is off balance, it actually can affect the other element. What this means is that bacteria or plaque accumulates in your mouth from everyday things like eating and drinking. They need to be mechanically removed daily by brushing your teeth. The infrequency of disrupting that by brushing your teeth can cause a buildup and may actually travel into your bloodstream through procedures or even through swallowing. The long-term effects of this can be severe as heart disease, high cholesterol, high blood pressure, Parkinson's, and others that are seen on the chart here on this PowerPoint slide. It's important to remember that your dental hygienist is on your side and is not only able to remove that buildup safely, but can assess your risk level for these conditions by doing an oral assessment. We are equipped with the tools and the knowledge to be able to look intraorally and possibly see these conditions manifesting due to the oral systemic health link. Now I'm going to turn it over to Raimi to discuss the next topic. Thank you, Bree. Now let's go over some good habits that contribute to your oral health. The first one is brushing. You'll want to brush twice a day for 2 minutes each time. If it's easier for you, you can set a timer. Be sure to brush both the fronts and backs of your teeth, and it's always helpful to use a toothpaste with fluoride to protect yourself from tooth decay. Next, it's recommended to floss at least once a day. I know flossing isn't everyone's favorite thing to do, but there are places on your teeth that your toothbrush can't reach. By cleaning in between your teeth, we're making sure to clean every surface of the tooth. When using dental floss, try to make the letter C with the floss so it wraps around your tooth easily and you can move it up and down several times between each tooth. Another good thing to do is see a dental hygienist every 6 months. Every millimeter of bacteria we leave behind while cleaning can harden and attach to your tooth. This is called calculus. So you'll need a professional to remove these hardened pieces of bacteria because brushing and flossing won't be able to remove it at this point. Last is a healthy lifestyle. We learned previously that there is an oral systemic link. So keeping your body healthy keeps your mouth healthy. For example, too many sugary or acidic foods can contribute to cavities. Those cavities can cause you to lose your teeth. As another example, let's say you have high blood pressure and you're taking medication for this. These medications can cause oral manifestations like dry mouth or an overgrowth of your gums, and this can make teeth cleaning really hard. When it's hard to clean your teeth, you can get diseases that stem from that, such as periodontal disease, which means you're losing the bones that keeps your teeth in place and working properly. So now that you've heard some good habits, let's go over some bad habits. Now that we have reviewed some good oral habits, let's go over a few things that aren't so great for your teeth. Smoking cigarettes can cause staining of the teeth and increase your risk for periodontal disease, as Remy discussed earlier. Dipping or chewing can cause recession of your gums and increase the risk of cavity development on the roots of your teeth. Although e-cigarettes such as Juuls and Puff bars come in a variety of different flavors, they still pose the same health risks as cigarettes. Alcohol consumption can increase your risk of cavity development because of the high sugar content. It can also cause dry mouth and reduce saliva production. Salivary flow is important to help reduce the ability of bacteria to stick to your teeth. Now, the reduction of saliva allows bacteria to stay on our teeth and increase calculus buildup. Excessive alcohol consumption can lead to vomiting, which in turn can cause erosion of your enamel due to the acidity from your stomach. Along with alcohol, sugary foods and drinks can also increase the risk for cavities and gum diseases like gingivitis and periodontal disease. These risk factors, along with poor brushing and flossing habits and not seeing your hygienist regularly, will contribute to an unhealthy mouth and potential tooth loss. Thank you, ladies, for that info on oral health. Next, we will talk about some resources that we have picked catered to you. Each resource provides affordable care and many different treatments, such as dental exams, cleanings, oral hygiene instruction, fillings, sealants, and fluoride treatments. These include your very own Sacramento City College Dental Hygiene Clinic, the Golden Valley Health Center in Turlock, California, One Community Health in Midtown Sacramento, Phoenix College Dental Clinic in Phoenix, Arizona, and Rio Salado College Dental Hygiene Clinic in Phoenix, Arizona. We have also created an Instagram, so give us a follow for some tips and info about oral health. Finally, your primary dentist is always available for treatment and can answer any questions that you may have about your oral health. Thank you for listening to our presentation. We hope that you've learned a little bit about oral health and the importance of taking care of your teeth. We will be sending out a post-test to assess what you've learned and see how well we did. Thank you for listening. We appreciate you.